All right, Anne Marie, can you see me?
No, I can't see you.
Okay. I don't know what else to do here. Let's see.
Paul, looks like you have a day off. Good for you.
Hi. Can you hear me okay?
Yep, great. Thank you.
Good.
You got my message that Nancy's not going to be able to join us, I assume.
Yes, I did.
Hello, Cheryl.
Hey, Cheryl, how are you?
Hey guys, how are you?
Good.
Okay.
Okay.
Hey, Jim, how are you?
Good.
Good to see you.
Nice to see you. Maybe we'll be able to get together one of these days.
That would be nice.
Yeah.
I think the whole world's feeling that way.
Yeah.
How was your trip, Dr. Marvel?
Very good.
It looks like you guys had fun.
Yeah, we enjoyed it. I'll tell you though, I'm not gonna drive all night one day anymore. If we go again, I'll stay overnight, going and coming.
That's why I always stop.
20, 21 hours is just too much.
Yeah.
All right. Looks like it's 2:00. And unlike most doctors' meetings, we'll actually start this thing on time. So Anne Marie, I was just looking on the website, looking for the minutes for the March 10th meeting, and they weren't attached to the agenda.
They weren't. Okay, I will find out. We'll make sure that we have them for the next one. I don't know.
I don't have them either, so.
Okay, so there are minutes from the February 26th meeting. We did not have those last time, so we postponed the approval of those minutes. Anybody take a look at those? Are they comfortable?
I
making a
do
motion?
not. Did you look at them, Dr. Marble?
No,
I didn't either.
I didn't get them.
Well, they are, They are on the agenda for, I guess, the last meeting.
They were attached to the agenda for the last meeting.
Yeah,
Oh, those, yeah, I did read those.
there you did. Okay.
Yeah.
Could I, are people comfortable approving those?
Yes, I don't see a problem.
I
Is there a
think
motion? Is there
so.
a second?
Right.
Cheryl, second. Is there any discussion? All in favor?
Aye.
Opposed? Perfect, thanks. Hi, Bob. Thanks for joining us.
Hey, thank you. Appreciate the invite. Sorry, I'm running late.
So I'll give you a little quick COVID update. Most importantly, Dr. Tam is on vacation this week for the first time since he's joined us. So he's not going to join us today. The COVID data is sort of mixed. I spoke to the mayor about this morning a little bit. The COVID numbers are down when you compare them to the surge that we saw in January and the beginning of February. They have, however, leveled off, and maybe hospitalizations have increased just a little bit. The infectivity rate currently is hovers somewhere in the high 4s. Sometimes it's as low as 3.8, sometimes as high as 5.2, but somewhere around there. That's been relatively consistent for the last month. Our hospitalizations have ticked up a little bit from the last time we met. The good news is that number of ICU admissions is down, which is good. Anecdotally, the people that seem to be getting admitted to the hospital are somewhat younger. We're seeing more people in there between 40, I'm picking a younger age, and 64, as opposed to the over 65 crowd. I suspect that has a lot to do with the availability of vaccine. So speaking of vaccine, the state is now currently at 1C. So anyone over the age of 50 is eligible. Anyone over the age of 16 that has any significant health risk is eligible, as are anyone who's a caregiver for anyone that falls into that category. And then essential workers fall into that too. So that gets us into a pretty broad swatch of our community who's eligible at this point. So it's kind of moving along. I think the amount of vaccine in the state has been relatively constant with the addition of the Johnson & Johnson. So, there's the access to vaccine out there. I would also say that some of the vaccine hesitancy that we've seen in the past seems to be getting better. And it gets better just, I think, by nothing more than time. More people that had vaccine hesitancy know somebody who got vaccine, or know a lot of people that got vaccine that have done well with it. And then as the media picks up on these ideas that perhaps will limit people's ability to do things based on their vaccination status, whether that actually ever happens or not, that seems to be motivating some people to get vaccinated, which is good. So I will point out to anyone that listens, and I know I'm preaching to the choir here, we're almost 120 days into our initial vaccinations in this country. And the vaccine is exactly what we thought it was. The side effect profile is exactly what it was. There have been no unusual side effects with it. It is actually more effective than what we thought. What has changed since the last time we met? We knew for sure that the Pfizer and the Moderna vaccine offered a prevention against measurable disease in a rate of 95%. What we didn't know is whether or not you'd still become an asymptomatic carrier, which is an important component of the disease. We now know that those people that are vaccinated are not asymptomatic carriers too. And that's really a game changer. That was the one big question mark that we didn't know before. So it actually, if you are trying to convince people to take the vaccine, it's even a bigger reason to do it, because now you can really say, you can say with a surety that not only are you not going to get sick yourself, you may or may not care about that, but you're actually not going to infect the people that you do care about. So, so things are moving forward in that respect. Do we have any questions about where we are with COVID?
What's the percentage of positives now?
So as I look this week, it's been in the 4s. The 7-day average is like 4.2, 4.3%.
Right.
So, that's a reasonable number. We were lower than that in the middle of the summer, but we certainly have been much higher than that in the past. So it is clear, though, that the COVID is still in the community. It feels like we're close, but we're not quite to the finish line.
I did read today where apparently on the 6th of April, they're going to offer the vaccine to anybody 16 and over.
Mhm.
Yeah.
Isn't that correct?
Yeah, there's also, yes, that's correct. Speaking of young kids, Bob, I don't know if you've seen this, that Pfizer just had a study that looked at their vaccine in peds, and it's very effective and appears to be safe also. Have you seen that?
I saw today, I heard today in the news, 12 and up maybe is what this
Mhm.
study looked
Yeah.
at.
I also saw something last night where they're trying like a half dose with children in the ages of 6 to 10 in an experimental group. They're working with a pool of 7,000 kids.
Which vaccine was that?
I believe it was Moderna.
Yeah, because Pfizer has already released some pediatric data. So I mean, that's great news. We're kind of getting where we're getting. So it is. It does make me sad at this point. We still have some fatalities in the community, and like we're almost there. So this is, but we still require some, some of the reasonable diligence that has gotten us through a year. So I know people are fatigued and tired. The other thing that's interesting is that when you look at the rates of other communicable airborne diseases that we would typically see in a winter, we didn't see them this year. So virtually no flu in the state. There's virtually no respiratory syncytial virus or RSV virus. And that's significant because not only did people not get it, but there's a significant improvement in mortality in that. If you have COPD, it really winds up being a common cold that ultimately is your demise. A common cold with impaired lung disease can lead you to the hospital and a ventilator and those sort of things. We haven't seen any of that this winter, which has been really nice. We also haven't seen a lot of the gastrointestinal illnesses that we see. A lot of the vomiting, diarrhea, those are almost always viral mediated. And we suspect this is all from mask use. Probably also from lots of good hand hygiene, everybody touching, alcohol wipes wherever they are, which is helpful, but the masks themselves, I don't think anybody in healthcare appreciated the ability to limit some of these other infections with like wearing masks and with hand washing. But it's been a good unintended consequences of both the hand washing and the mask use. So, Bob, where are you guys at in the school?
We continue, anytime I speak to my groups or board meetings, I continue to kind of say, hey, we're not out of this yet. We need to make sure that we're sort of on top of all of our protocols. Even though it seems like we're in a great spot, we still have more cases than we did in September when we opened school.
Yeah.
I think the community-wise too, thinking of like a zip code to make up our school district. I was looking at this the other day again. I think we were averaging in September like 26, 30 or so cases per week for those zip codes. And that's about where we are right now. We're a little bit higher than that right now. So it seems like if people want to relax because of where we were in January and February and December, but compared to where we were at the start of the school year, it's still something that we're being cautious about. One of the reasons why we don't going completely different and opening up, even middle school sports at this point, just new people, new situations, new coaches supervising kids that haven't done it in that setting yet. So we're kind of just being cautious and really focusing our efforts on slowly increasing the number of kids in our classrooms, and as long as we see the data remaining the same. So we're starting after spring break to have that every other Wednesday in school for middle school and high school students, that maybe just remote for everybody on those days. And we're also looking at finding ways to get more of our elementary students back in, remeasuring all of our classrooms to make sure that we're still within 3 feet. But if we can do that and add 1 or 2 more classroom desks, I mean, if we put 1 desk in every classroom or even 2, that really takes every student who wants to be in school off the wait list, and I believe still does so safely. So that's what we're trying to do now, just get as many families and kids with in-person instruction that would like it at this point, and continue to stress the importance of all of our social distancing protocols that I felt have been worked very well this year.
Yeah. Hopefully by September, it will be business as normalish for you?
Yeah, I hope so. You know, we have a group of seniors that really haven't been in school too much since last March, and we're even thinking about the end of the school year and some of those events for them. I think I may have mentioned it last time. We're kind of looking how graduation can look this year for our groups, and even if we can do something outside with social distancing protocols and having more than one graduation ceremony, just so the numbers are small, and just do something for those students.
Yeah.
Kind of work through some of those scenarios.
Yeah, they've missed a lot. I can't imagine missing, it's one thing to miss the end of your senior year like they did last year. That's bad enough, but to miss your entire senior year or nearly, that's gotta be tough.
Yeah, but we've been fortunate to kind of do a lot for just, some of the, the band kids this year, and our athletics have been participating, and so far so good. We've had to issue a few reminders to different teams throughout the year, but overall we had just, one situation where there was, several quarantines and during the winter sport. But other than that, we've been pretty good and pretty fortunate that those kids have had that experience this year and have done it without, the spread going on. So, and here we are in the spring, almost in April. So that's definitely a positive thing.
Yeah, it's good. Anybody else have any questions where we are with COVID right now? Ted, you said you had a call with the governor recently?
We had a call yesterday with the governor, and we're a lot of discussion about mask fatigue, which I think everyone is aware of, and I think we are obviously some of our neighboring states have lifted their mask requirements, so we're seeing a little bit of an uptick in mask wearing compliance here, trying to get people to remind them to wear masks, but overall it's still pretty good. Governor's still very cautious about large events. And we as a city have not made a decision yet about the 4th of July fireworks. We were going to meet the end of last week about it, and we postponed that meeting till the end of April. Obviously, if we were to try to go ahead with it, we'll be filing with the DPH to get some guidance as to what can and can't happen. But overall, the governor was pretty encouraged with the site vaccination, the vaccination site, and how that's going. I mean, they vaccinated over 10,000 people over the weekend last weekend, which is pretty phenomenal. And then I think I shared with you this morning, News Journal ran an article on Monday that Sussex County, not Sussex County, but the 19958 has one of the highest vaccination rates in the state. Up there with Hockessin being the other one that's high, and down in Bethany. And the other thing we've seen is some people are resisting, as you mentioned, Paul, getting the vaccination until they get some kind of endorsement from whoever they view as their community leader. We've had people say, I'm not going to get the vaccination, and then until so-and-so says I should get it. And that has helped in some cases, particularly in the minority communities, where someone who's a trusted member of the community says they've gotten it, they didn't have a reaction, and that has led to other people going ahead and getting it. So we're encouraged, but there's still room for improvement. Thank you.
I've kind of made it a point in my professional and personal circle of friends and acquaintances to ask people if they've gotten the vaccine.
Yeah.
And it's amazing how many of them have not gotten it. And once you talk to them, they're like, actually, maybe I will get it, and they do get it. So, it's a lot of people have never made a healthcare decision before. So it's tough for them. Where if you've been sick before, or if Dr. Marvel and I are in the business, and Cheryl, we make healthcare decisions by the hundreds every day. It's not much for us, but it's a lot for a lot of people. So you're right. It's just a matter of kind of talking to everybody. And again, I think the most important thing is that there's real meaningful volumes of data out there now. I mean, there are tens of millions of doses delivered in this country. We know a lot about how this stuff looks now over, like I said, 4 months. So it's really, the safety profile is exactly what we thought it was.
Yeah.
There
was an email that came out last night from the governor's office saying that we're very near 500,000 doses being distributed in the city, in the state, which
Yeah.
is really good.
You know, I saw that number and my first thought was, well, great, that's essentially half because our state population is like 990. But
Right.
then I realized that a lot of the people that got the vaccine here are probably not counted as Delaware residents.
Well, that, and also that's one dose rather than, it's, if we're getting 2 doses, that may not be an accurate number to think that we're halfway, but it's getting there. A lot of people I know have gotten their second dose or are getting it this week.
I thought it was good what Dr. Fossey said the other day. He said, we're at the corner, but we
Yeah.
haven't turned the corner yet.
Yeah,
Yeah, that's a good way to describe it. It's yeah, we're sort of almost there. It actually it makes it a little bit harder to take care of people now than it did in the throes of it, because it just, when we're in the middle of the storm, it just is what it is, and there's nothing to do about it. But now that there's vaccine out there, every time I take care of somebody who is sick who didn't get a vaccine, I'm like, gosh, this could have been prevented.
right.
But yeah.
Dr. Cowan, is it true, I think a little bit the conversations we've had with DPH and others at the state level, that if, like I said, there's a small office space where you have 3 people sharing an office and all have been fully vaccinated 2 weeks past the last second dose, are those people able to be inside and work without masks as long as they are by themselves? Is that
So I can't tell you for sure if there's state guidance on that or CDC guidance. It certainly makes sense based on the data that we know that people are not asymptomatic carriers once they're vaccinated. So that would seem reasonable.
Yeah, I believe in our conversations I've heard, I just, me to confirm it before we get out and kind of share that, but that's a huge deal for us, just with like teams of teachers who happen to meet regularly, just be able to meet more freely. I visited a cafeteria a few weeks ago and talked to the cafeteria manager, and she talked about the number of her staff members who are vaccinated, not all of them yet, but that would be awesome for those cafeteria workers if they actually could work within their kitchen at least, and kind of have that freedom to kind of work with each other without masking. Those kind of things would be really helpful if they could do that. I think it would be an encourager to those to get more people to get vaccinated. I think people would appreciate being able to do that, at least in a work environment in a certain setting. So
Yeah, I agree. I actually had I'm in a private practice and my group met live for the first time yesterday since the pandemic started. And yeah, it was great to do. And, I actually have partners that had never met in person because they became partners last year just when the pandemic started, and they had only known these Zoom meetings. So they probably wish for the Zoom meetings after one live meeting, but it was still good to see.
Yeah.
So.
Hey, Paul, if I could add something. So I did look up what Dr. Fulton was just asking. And on the CDC website, it says when you've been fully vaccinated, you can gather indoors with fully vaccinated people without wearing a mask. But you all have to be past that 2 weeks. Do you want me to send that to you?
Yes. Does it give you a number though? Number of people in the group?
Hold on. Let's see. No,
Okay.
it doesn't give a number. It just says if you're in public or you're with other people who aren't vaccinated, obviously still, all the precautions. I'm looking to see if it says a number.
I don't recall seeing a number on it.
Did you see it, Emery?
I have seen it, and I don't recall there being a number.
It doesn't say a number. It just gives like a table. It just has this picture of a table with 3 people sitting there, and they don't have masks on.
Okay.
That's where the 3 number came from, I guess.
I don't know. It's just it's a picture.
Right.
we'll definitely confirm before we kind of move forward for sure. And I guess if the number got too large, it would also be hard to know because you have to ask too many people if they, you really can't do that either. So
Yeah, it also comes down to a trust factor.
identify themselves as being vaccinated, that group could do that possibly. So that's at least good to know. And actually, it is for those who are kind of like not sure. That is something that motivates people to be able to kind of
Right.
not be the only person in the
Right.
group or something that may be is causing the rest of the group.
And that may be where the vaccination card really comes into play. If you're not wearing a mask, you need to show your vaccination card. And
Mhm.
of course, I'm sure that's why I think in most public places, it's going to be hard to move in that direction.
Yeah,
But at work, I mean, maybe that would help us get some of the people who have resisted the vaccine to
Yeah.
consider it.
yeah. It just says, right, Amory, it doesn't give a number. It just says you have to be past your 2 weeks after your last dose or after your only dose of Johnson & Johnson.
Okay.
What'd they say, Cheryl? Did it say 2 weeks? I had heard 2 weeks.
It has to be 2 weeks after your
2 weeks
second
after.
shot or 2 weeks after the Johnson & Johnson one.
Right.
Yeah, because it's only a 1 dose, but yeah, it has to be a full 2 full weeks, or it says you're not protected.
Okay. Does anybody else have anything with regards to COVID?
We do have a hand up. Trina Brown Hicks has a question. I can unmute her.
Yes.
Trina, you should be able to talk now.
Okay, can you hear me?
Yep.
Yes.
My question was, do you anticipate, and I don't know if you've already talked about it, so I missed a little bit of the call, but do you anticipate that there will be a need for a booster type vaccine, considering the variants that are moving about now?
I don't think anybody really knows the answer to that. At this point, the vaccines have been very effective against the different mutations of the virus. And again, remember the virus mutating is the normal life cycle of virus. So it's nothing unusual to hear that. There is a possibility that if it mutates, and it has to mutate in 2 ways. It has to mutate in a way in which it's very successful as a spreader, because that's really why the current COVID has been so difficult, is because it spreads very easily. And it also has to mutate in a way in which the current vaccines are not effective. So it kind of has to hit 2 home runs at once. Is it the possibility? Yes. But I don't think anybody really knows that. And when people have spoken about that, they're kind of guessing if that happens, it would not necessarily be an annual vaccine, but maybe a vaccine that you require every couple of years. Without a doubt, the more people that get vaccinated, the fewer spreaders we have in the community. This is really worldwide. And the fewer spreaders we have, the harder it is for the vaccine to mutate and spread. So that's a long answer for, we don't know. But it's a good question, and it's something that we're going to pay close attention to over the next like 12 to 18 months. The other interesting thing with that is that, the way influenza survives is that influenza travels the world, where it's in the northern hemisphere in our winter, it's in the southern hemisphere in our summer, their winter. And the vaccine for instance, the vaccine that we had this current flu season was developed based on the way the influenza virus looked last summer in the southern hemisphere. But we didn't really have much of any influenza in the northern hemisphere this year. So I'm not really sure what's going to happen to influenza going forward. Does it sort of die out because it's been harder for it to mutate, because it's been harder to transmit? And again, this gets back to the mask wearing, and actually, I think vaccinations were up this year more than ever before. So it'll be kind of interesting to see, and that will actually give us some idea as to how coronavirus, although they're certainly different viruses, behave differently, but the fact that we've been able to create a hard wall, if you will, for influenza this year may give us a sense for coronavirus going forward also. So some kind of interesting unintended consequences of all the things we've done for coronavirus. But it's a good question, though. Thank you. Trina, I have a question for you. Do you have a sense for our local African-American community about their acceptance of the vaccine?
Can you hear me?
Yes.
Okay. I really have seen more people are moving towards the vaccine, and I was one of those skeptical ones, I have to admit, but I did get my shot yesterday, my first shot. So if I moved, somebody else is moving towards it as well.
Good.
But I was on the latent path there. But the more I listened and studied and acquired more information about it, I became more comfortable. And the one thing that really impressed me was my PCM. My doctor actually sent out a text and said, you know, you're welcome to come and get that. So I went to my doctor's office and acquired mine. But I do see, when I talk to members in my church, a lot of them are now moving towards getting the vaccine, or it's mentioned that they have received it. So
Good.
that's good news. But I do have one other question.
Yes.
I saw or been seeing where now some of the younger kids are now doing some trials with becoming vaccinated, because it looks like they're starting to peak in that area. Could you speak to that? Is that happening here?
So both Pfizer and Moderna are studying the utilization of the vaccine in the pediatric population. Pfizer just released a study. I'm typing my iPad as we speak, just in the last day or two, that demonstrated that it was, yeah, here it is, that it is safe in kids from age age over 12. So, so yeah, and I think Moderna is doing the same studies. So I do think that the vaccine is exactly what we thought it was going to be. And I think it's going to be the same thing in peds too. So it's coming. The good news is for kids in that age group, they tend to handle the virus, generally speaking, really, really well. There are a few of them that don't, but that becomes a really, really small number percentage-wise. Well under 0.5% do have a struggle with the vaccine. The issue, as we know, is that they have families, they have grandparents and people that are otherwise at risk. So, I do think that we will. There'll be a big push for vaccinating kids. I suspect that in our summer meetings, we'll be talking to Dr. Fulton about, vaccination of kids and what that looks like. So, but yeah, again, another good question. Thank you.
Yeah, with the recent news about the 16 and over and some timelines for those vaccinations, we're sort of thinking about how we communicate that to our students and to our families so they're aware of it and make sure they know when and where it could be available to them and their children. So
yeah, good.
At high school, the 16 plus, just to have more and more students vaccinated as even in the next school year.
Right.
Not just they become safer, but obviously, as you said earlier, then they would less likely be able to transmit to somebody else. So that would be huge.
Yeah, I'm not sure who is more likely of a spreader, an elementary school kid who may struggle understanding the rules, or a teenager who is mobile just by the nature of being a teenager.
Probably teenagers, I would think.
Yeah, probably. Okay. Any other questions with regarding to COVID?
I
Okay.
don't have a question, Dr. Cowan, but I just wanted to give you some positive feedback. I
Okay.
just this past week have talked with 2 people that were admitted through the BBER with COVID, and they were fortunate enough to have you for their physician.
Oh, gosh, thank you.
like care.
Yeah, thank you very much.
You know,
That's
they
nice of
said
you to
the
say that.
nurses were wonderful. Everybody was so good.
Good. You can thank Dr. Marvel for that. He played a big
I
part in
know.
the school, so,
Yeah.
right. Okay, so if there's nothing else with COVID, I don't see Mr. Carter. There'd been a request to address us with regards to a solution for a plan of people that are visiting the Lewis Beach, urinating and defecating on the beach. So, yeah, exactly. That's Bob. That's the same way I thought when I heard about it. But so I guess we'll table that, and I guess maybe he'll be able to join us in our next meeting.
Okay.
So I don't see any other agenda items. Anne Marie, am I missing anything?
Nope, I think you're good.
Okay, so if we can look for a date then.
It's like we might be looking at the 21st Wednesday, April, or maybe the 20th. Looks like Anne Marie and I might have something on the 21st at 1:30.
20th is fine with me.
Does Tuesday, the 20th work for you, Paul?
Having some technical difficulties, trying to pull my schedule up. It'll be just a second.
Sure.
What was the suggested date that I hear?
Tuesday, the 20th of April,
2 p.m.?
depending on what Dr. Cowan's schedule is, yeah.
Actually, I'm not available on the 20th. Is
I'm not either. I've got a class to teach.
is there a time on the 21st that works?
Can we do it at like 12:30?
Yes. Does that work
For
with
you,
you?
Anne Marie?
Works
That'll
for
work.
me.
Yeah,
Does that work in your schedule?
Does.
Perfect.
Okay, 12:30 on the 21st. huh? Okay.
Great.
What time?
12:30,
12:30,
April 21st.
right.
Bring your lunch.
Right. Perfect. Okay. So do we have anything else then?
I think so.
All right. Well, thank you, everyone.
Happy Easter, everybody.
Yeah, happy Easter to you all. Thank you.
Thanks.
Be safe.
See you.
Yeah, bye-bye.
Bye.
Bye.